artery is related with some kind of major artery, so you need to be very careful. There's a lot of variation between patients, so always careful about before injection. And middle temporal vein, you guys know about this one? Yeah, it's very close to zygomatic arch, so when you try to insert cannula, you should be very careful. And no branch, facial nerve branch around this area, you should be very careful when you inject filler. This is the space between superficial temporal fascia and deep temporal fascia, and this space is the main area for filler injection. So, when in the case of cannula injection, yeah, this area is preferred for insertion. And for when you use long needle for periosseous approach, you inject filler in this area. But if you go too far, that makes your face wider. So the injection point should be close to eyeball. So malar augmentation is also very popular in Korea. Hingwoji, famous. Yeah. So two-layer technique I prefer for deep area covered by soup, and superficial area for malar area, superficial malar fat. So this is the very effective point when doctors inject filler here. Patients are quite satisfied unexpectedly. So, but if you inject too much, it may cause some bump. So you should be careful not to inject too much. Under correction is recommended, and simultaneously cover some crease here, simultaneously deep and superficially. And sometimes the facial artery, detour branch of facial artery course along this area, so you should be a little bit careful for gentle movement of cannula or kind of something. And here, tear trough, you also can simultaneously cover tear trough and here, anterior malar cheek suppression. So here, but as you may experience, some Tyndall effect can happen with tear trough filler injection, but I think the incidence is quite low for EVAR Classic because it's made from homogeneous intradermal distribution, and so I think EVAR has strength for this point injection. For buccal area, so you can relatively safely inject filler in this area, so fanning technique or vertical injection can be, you can apply this kind of technique. So for submalar area, inject in the superficial fat layer, and buccal area, you can inject both superficial and deep injection. So here for your buccal position, because a lot of Asian people have sunken cheeks, so if you inject filler, you can inject a large amount of fillers in this area safely. And for subzygomatic area, you should get inject filler in this approach. The superficial approach is preferred for this area. And nasolabial fold is one of the major areas when filler, you can apply filler. Body one, right? A lot of fillers here. I usually, as I said, two-layer approach is preferred. So deep layer covered by classic and superficial layer by more light one. So two-layer approach is my favorite approach for filler injection. Inject deeply or very superficially. Yeah, I think all of you may agree because some kind of vascular accident happens. So I recommend you inject filler while the patient is seeking. Nose augmentation, long bead. And so it's also very popular in Korea because the Asian women sometimes are very low compared to Caucasians. So inject filler in nose augmentation is popular. So, but you should be a little bit careful when you inject filler in the nose because major vessels around the nose. Sometimes vascular accident happens in this area. So try to inject filler into the midline, and if patients already got plastic surgery, filler injection should be very carefully injected because that means that vascular supply is not enough compared to pre-surgery, so you should be careful about filler injection. So inject little by little and don't inject forcefully if too stiff. And regurgitation is recommended to confirm bursted blood vessel. And the last one is chin augmentation. So chin augmentation is relatively easy and you make your face more egg-shaped. So it is also widespread in Korea. And it's kind of relatively safe. And I usually prefer to inject with needle instead of cannula. And scapular approach is my favorite method. So because if patient chin is receded or small, you can make your face a little bit awkward. So using filler, you can make your chin lengthen and protrude. That makes your face more refined and beautiful. So let me pushing together to the mentalis muscle. Okay. So this is the summary of filler injection. And actually, our Asian people have relatively wider face compared to patients. So I think some patients from United States or Europe also visit our clinic, and what they say is completely different from patients from China or Taiwan or East Asian countries, because the criteria of beauty is completely different between Western and Eastern people. They have more narrow face, so they want to make their face more three-dimensional, a little bit wider and triangular, but our Asian people like to make face more oval shape, a bit different. So Western people like quite gentle shape, and our Asian people to make their vertical face augmentation. So they want to inject filler in this area, more lateral area, but our Asian people like to make their face a little bit vertical, but Western people like to have horizontal. So it's kind of different. So always ask patient, because it's not therapeutic, it's beauty. So you should communicate with the patients for what they want. And as far as I'm concerned, the difference between white Western and Eastern people have different point of criteria for their beauty. You agree, Mike? But you also see international patients, mainly Taiwan patients.
Most are Asia. Most are from Asia.
Asia. So this is my experience for filler injection. After about 10 cc of UV filler correction make their face more younger, and because people with the sunken area, they think they get older and they feel ill, or so if they get filler here, I think rejuvenating efficacy is very nice. You can combine with filler with other kinds of rejuvenation modality, including Somage or Cera or kind of something. It's kind of very common in Korea. So even strategy is also common in Korea. So this patient with the chin is a little bit small, so filler here, for sunken area followed by filler, and 7 cc of e-water filler makes this patient happy. Also, even 13 depends on patients, but this program can make patient completely different. But the side effect is very low compared with plastic surgery. So I think this kind of plastic surgery is very nice. Yeah. These patients, 10 cc of filler can make profile more refined, and so. But I think generally I usually prefer cannula, because vascular accidents makes very dreadful result. So you should be careful when before you do procedure with filler. So I have many experiences, but even now I pray before the filler injection, because sometimes it happens. So you should be very careful and you should be more prudent for procedure. So preventable side effect includes bruising, irregularity, and vascular embolization, and sometimes this can happen. But I think skin necrosis and some kind of blindness may be the most dreadful. If this happens, we should close our clinic, right? Very, very careful for filler injection. But I want to tell you that even these kind of things happen, we can have a lot of methods to recover this kind of damaged states. About 80 to 90% of this kind of necrosis can be recovered. You should not be too worried about this one. And this kind of side effect is related with patient's experience and dexterity. So I think this sentence is very impressive. So 一些副作用和医生的操作水平有关系。你同意吗？你们同意吗？对。If you have experience, you can overcome many of these side effects. So today, Eva make this meeting. So they have their special technique, high technology. Actually, my major before joining medical school was chemistry. So I'm kind of know about this kind of chemical reaction. Chain reaction is kind of easy reaction. But the advantage of Eva is the high concentration, high molecular HA. So we Korean doctors agree that Eva filler is comparable, even better than Restylane or Juvederm or